welcome everybody. We're going to go ahead and try to get started then.
Okay. So I'll highlight some verbiage and we'll go from there. All right.
Unmute. There you go, Kyle.
Thank you. Okay, so everybody can hear me, I'm assuming. It's great to see all of you. I want to especially welcome our spotlight people. Robin can join us now. This is great to have her there, as well as Liz in Tucson, and we have Nina in Las Vegas. It's great to have Nina with us. They do a great program there in Las Vegas. So this time of year, or this time, it's a difficult and trying time for all of us, and there's probably never been a more important time for us to stay connected, learn from each other, and work closer together to serve our vulnerable seniors. So today, we want to put the spotlight first on pastors. Bill Cave is here with us, and hear about what they're doing, and you know, again, like what can we learn from those who are out there. Bill, can you hear us okay?
Yep, I can hear you just perfect.
Great. The time is yours.
Oh, okay. Sorry, I didn't know that was the pass off there. First of all, Kyle, thanks very much. I think it was about 2-3 months ago where I was actually at the spotlight meeting out in the West Side. So it's good to be back. I'm here for Randy, obviously. Randy's the president of Passers. For those of you who don't know me or what Passers is, it's good to see some familiar faces too, like Laura, and I'm going to talk to Sean and Paul and Shanna. But Passers is the trade association for placement agencies and senior referral specialists here in the Valley. It was started here, but it's actually rolled national. So it's called the NPRA, which is the National Placement and Referral Alliance. And there's different chapters around the country now, but Passers is the original model for that around the country. So I sit on the board of directors of Passers. You know, it is a placement trade association, and we kind of oversee some things for the industry. But there are a lot of other people who are on the board of Passers who participate, like elder law attorneys, homeowners, senior services in general. So that's my quick pitch there, and I'll kind of come back to that because we have board turnover, and obviously anybody who's interested, it's great to be a part of it. Passers, real quick, just on myself, my wife and I own an agency called About Seniors. I think we're going into 14 years now, so long time in the Valley. Others on the call may know me from the Area Agency on Aging. I'm also a volunteer Medicare counselor. So I'm a SHIP counselor. I'm certified, give a lot of presentations. And then last but not least, my latest venture, just to introduce myself, is I am a reverse mortgage specialist for Fairway Independent Mortgage. So it's a growing area. A lot of stigma attached to it. A lot of that's no longer in existence. The progression for me is pretty natural. You know, people don't always want placement, and they've come to us and they don't have the finances. So pretty simply, reverse mortgages is just another tool to allow those people to stay home, get in-home care. I'm working with a lot of in-home care providers now. So the reason I'm saying all this is to introduce myself, but also I'll remain on the board of Passers. My wife still operates the placement side of things. We do have some employees, and you know, it's kind of interesting times. In general, Passers right now, we're very active. For those of you, the first thing I'll point out is tomorrow morning we have our monthly meeting, and it's actually on preventative measures for COVID-19. It's going to be a good educational. We have a good educational webinar. We have a couple people from the Mayo Clinic. We have a panel that's going to talk about the measures and what's going on in a little bit more depth than what I'm going to cover today. But in general, you know, I think we're all feeling pain. senior industry overall is slowing down. The placement side of things is slow. There's no other way to put it. It's slow in the sense that a lot of discharge planners, a lot of hospitals right now, they are trying to send people home if at all possible. They're using placement sort of as a last resort just because of all that distancing. We've had placement, a number of placement resources that are closed door right now. What's happening on the industry as a whole, and we're working very close with Aloha, which is the assisted living home association here in Phoenix, in the Valley. And we're working with them to identify homes, because there's a lot of homes right now that aren't even accepting new residents, let alone visitors, let alone touring, let alone, being even open to taking in somebody. Some of the homes we've identified, they've had COVID-19, residents. Some of those residents, even if they've moved out, the homes are hit hard because they don't have the resources to provide those one-on-one type of care, the staffing basically. The larger communities, some of them have COVID-19 cases and residents, and we're working with them. So, but there's a lot of logistic problems as well. Not only the fact that the industry is slowed, but even if we come in contact with families, we're doing a lot of virtual tours, most of their phone assessments and things like that. But even if somebody wants to go see a home or go around, we want to try to make available, it's difficult getting masks and gloves and being able to get those for people. It's getting a little bit better, but those are all issues, obviously, that play into anything from the placement or referral side. I mentioned Aloha already. Alltech is another big area right now. We've actually hired an attorney to work with we have subcommittees to work with the subcommittee from the Alltech side. We're working to advocate for the homes, for level playing field as far as reimbursement rates. The immediate need right now because of COVID-19. A lot of homes, like I mentioned, just aren't taking those residents. So we're trying to identify the homes that are going to take those residents and under what circumstances they'll take them. And I'm not referring just to COVID-19, but it's a scary thing for a lot of homes. So they don't want to let anything into the environment that could taint that or show up a little bit down the road. Quick story. We had a client that reached out to us, and it was a past client. She literally asked, is it illegal for the home to prevent me from going to see my husband? And, now the Department of Health is sort of backing a lot of the homes and their policies as far as restriction of visitors. But the answer was, legally speaking, no. But you have to be aware that if you go in that home and somebody gets sick, or you just, I got to go see my loved one, and you go in and somebody gets sick, all visitors are going to be reported to the Department of Health, and you could carry some liability down the road. So it's just a lot of moving pieces, a lot of issues for people to be aware of at this point. As going back to the Alltech piece and sort of the leveling the playing field, a lot of people may not know this, but assisted living homes are reimbursed at a lower rate than some of the larger communities. We're working with to help make that fight and advocacy to level that playing field, raise the daily rate for residents. Just a lot of logistic pieces like holding beds when they go back into the hospital, 30-day notice. A lot of these things are common sense and written into contracts, but they're not standard across the industry. So, and PASSERS really stands for, advocacy and standardization for a market that has a history as well. So things have evolved here for a long time. When I went to school for health administration, this industry didn't even exist. So it's great to see, and that's why I'm part of it, of course. The other big thing is national certification. So PASSERS is now, just in January, started the process to certify a placement agent. So they can carry a designation And that's another push towards sort of strong. So down the road, it'll be make sure you're working with a pastor certified agent. Of course, we'll get there. Another big thing is on the legislation side. Pastors advocate for, the HB 2529 bill, which is disclosure of conflicts of interest, disclosure of fees. The other big one that's coming down the road pretty soon is going to be family choice, similar to like real estate agents, and the ability to work with who you want and not just have be in the human body commodity brokering business, because that gives us all a bad name and a bad reputation. So certification, credentials, and then last but not least, I'll just kind of end on our board. We have a lot of members. Pastors has been around for 10, 15, I think I want to say 15, 16 years now. Started by Scott Fisher, Rita McBride. A lot of you people know and work with them. But it is becoming a national movement. We have, I believe the number's about 12 chapters around the country. But if anybody's interested in becoming more involved, I personally am involved on the educational committee. I also do public outreach like I'm doing right now for the board. But we have about a dozen board members, and some of them are turning over, and we're always looking for fresh blood to come in with new ideas or advocacy for different that. If you're interested, just reach out to me or Randy Mendinger, who is the president of Pastors. There's a application process, of course. I'll give you his information if that's something you're interested in. If you're available, I encourage you to attend the pastors meeting tomorrow morning. It's at 8 o'clock. Go to the website mra.org and you can register for that meeting. And it's all about COVID-19. So, I encourage you to do that. Thanks very much, Kyle. If there's any questions or anything, I'm more than happy to answer.
Questions aside.
I definitely can hear like a.
Let's see here. Hold on. 1 second. There we go, Bill. Go ahead. All right, Bill, go ahead. Sorry about that.
Okay, so
some people had unmuted themselves somehow, and so I think we're getting some feedback there. Bill, real quick, I know some people were asking for your email address.
So my email is bill@aboutseniors with an S, az.com.
Okay.
Bill at
seniors.
Oh, there you go. Thanks, George.
Cool. Yep. Let's just put that in the chat for everybody.
Awesome. Thanks.
So, any other questions for Bill?
Let's see. Robin O'Connell asked, how can we address the issue of safe discharge for our seniors?
That is, that is something that we are absolutely fixated on right now. It's all about safe discharge for seniors. Unfortunately, there's no playbook on this, so we're all communicating and trying to do the best that we can. I don't want to overstate it, but again, that webinar tomorrow is all going to be about discharge planning and trying to standardize a lot of the processes and the issues that we're facing right now. So that'll be tomorrow morning.
Okay. Hey, Bill, is the meeting 8 o'clock in the morning or 9 o'clock? I think it said 8 o'clock Mountain Time. Is that not 9 o'clock Pacific Time?
It's 8 o'clock tomorrow morning. You know what I'll do is I'll actually let me verify that.
Yeah, I thought that the Eventbrite said 8 o'clock Mountain Time, which I believe is 9 o'clock Pacific Time, which is where we are now.
Yes, that would make a lot of sense. I'm going to verify that when I get right off the line, just to make sure I don't give you bad information. So I'll
okay. Thank you, Bill.
Yep. I'll put it in the chat before we all disperse.
Cool.
Thank you.
All right. Thank you, Bill. Any other questions? You can unmute yourself, I think, and ask a question. Is that right, George?
Yeah, absolutely. Just go to the bottom left, unmute yourself. And then be sure to mute yourself when you're done so we don't get any feedback.
Bill, what was the website that you had provided? I couldn't hear it because of the feedback.
Yeah, I was trying to speak over that, but it was kind of getting loud towards the end. So it's www.npra.com. No, I'm sorry, .org. But it's not coming up right now. I will also send that out via chat before we all get them.
Okay, that sounds great.
We all get part.
All right, any other questions for Bill? All right. Well, next we have Sarah Kaufman. Can you hear us, Sarah?
I can hear you. I'm muting. I can hear you.
Wonderful. Thanks, Sarah. Sarah is with Windsor Healthcare. And Sarah, just maybe share with us a little bit about what's going on as far as what you can see and how we can work better together.
Sure. So sorry, I missed the beginning, and so if I'm repeating any information, I apologize, everyone. I was having trouble logging in. But Windsor Healthcare is our communities and behavioral care units throughout Phoenix. So we do have SNF, we do have assisted living, but our focus is the behavioral care units, which are split up among the 5 Arizona facilities. We're based out of California. So we are definitely still admitting during this time. I would say our admission volume is down just like everyone else's is. A lot of our admits, though, are coming from the emergent behavioral health needs. So we're still working very closely with them. The scary part for us right now is admitting from the group homes that we don't have normal relationships with. We have a lot of great relationships with, it's these new ones as behavioral health episodes happen that they're wanting to transfer, and we're really wanting to get them into the psychiatric care first before we admit. But I'm sure you guys have all heard of the facilities. It's just Windsor isn't ringing a bell. We're working on our rebranding. But Palm Valley on the west side, Maryland Gardens, Ridgecrest, Encanto Palms, and then Austin House is our facility up in Cottonwood. So we just kind of have it broken down. I'll go over a little bit of each of the facilities. And if anyone is having any issues placing behavioral care residents during this time, we have a specified behavioral health care liaison. Her name is Sheila Brumfield, and she reviews all of behavioral health placements. And then if you're not sure which facility or which level of acuity they need to go to, that's where we bring Sheila into play, and she can usually place them in one of the 5 facilities based on bed availability. A lot like our dementia units and our wandering dementia with behaviors are a little bit full right now, but our high acuity SMI units are open. So it just, we can get you on a waiting list too and double check. I would say we're noticing, as everybody, the traditional units and the skilled units is where we're having trouble. A lot of our long-term care have filled up. We do have COVID units in our 2 big skilled nursing facilities, Palm Valley and Ridgecrest. We do have smaller units over at Austin House and, Encanto Palms and Maryland Gardens, making sure that we are ready. So we're keeping those units just like everybody else, ready to go in hopes that we don't have a patient, but ready if we do, and making sure that they're isolated and secured. And, including with our behaviors. That's where it gets tricky. We need to add those one-on-ones on the behaviors if something were to happen based on their diagnosis. Any questions so far? You want me to just keep going, Kyle, and just break it down a little bit more?
Yeah, tell us a little bit more, and maybe what you're seeing out there as far as skilled nursing and hospital discharges, things like that.
Okay. So for the hospital discharges, I would say most of our hospital discharges have slowed down, like I said, on the skilled and long-term, but the behavioral needs are definitely there. We're probably admitting 1 a day to Ridgecrest and Palm Valley right now. Palm Valley is very unique because we do have a vent and trach unit, and we also do the bedside assisted dialysis there for the patients that can't get out. So that's really helpful right now when we're not wanting to add any of that additional exposure on sending patients out to dialysis, and we're able to do the assisted there. We're just very limited on the patients that we're taking. We're trying to only take patients that it would be a huge risk to go out to dialysis. So we want to make sure that we're keeping those patients in-house. And then, as we all know, from everything we're hearing on this with the vents and trachs, we have that unit is full currently, and we're just working through. There are not COVID patients on it as of today, but we are prepping for if we need to be ready and have that available to the hospitals. Everything else, for the most part, has been pretty slow. We're just running through the process and doing what we need to do. Ridgecrest has our skilled unit, has our traditional long-term, and then they have 4 different behavioral healthcare units. We have a high acuity SMI behavior unit there. That one does have a handful of open beds, and this is a 2-to-1, so 1 patient per 2 CNA. So it's a very high acuity RAN unit. Lots of staffing going on there, making sure that everybody is safe. Behaviors are included but not limited to history of physical aggression to the point of hurting others, self-harm, recent suicidal attempts, sexual aggression, and extreme temper outbursts of a physical nature. So anyone at that. The biggest thing that we're finding trouble placing some of these behavior residences is sometimes what traditionally you or I may consider a behavior, because we all have behaviors and some history of that, versus the insurance. So it's constantly going through the insurance and making sure that they are in the behavioral health system and that they do have a behavior diagnosis and making sure that they're getting off correctly based on the unit. Sheila does a great job on that after reviewing the patients and making sure that their behaviors are appropriate for the correct unit, and we're getting the correct level of authorization for that. Then we have 2 high acuity dementia units. One is an all male private and one is an all female private. A lot of that is sexual aggression and then fear, things that have happened in their past where maybe they don't want to be around somebody of the opposite sex. Those units tend to run pretty full, those dementia behaviors. They're all private rooms, and just making sure that those secured units are just limited by either male or female. And then we have our standard dementia with behaviors unit. That unit does also have beds open currently if anyone is looking to place there. Behaviors include residents combative with care, poor intake, disruptive behavior, non-compliance with critical care, intrusive, wandering, verbal aggression, and sexually inappropriate. So I'd say that's the big areas for Ridgecrest. Palm Valley, I mentioned the subacute vent trach unit, the secured wandering dementia, traditional long-term care, and then they have the standard SMI unit over at Palm Valley. So they're more on the acuity side of it versus Ridgecrest is more on the high acuity behavior side of it, high acuity clinical, excuse me. Maryland Gardens is our skilled nursing, and we step down to the SMI behavior unit. That's a really unique building. If you guys have never seen Maryland Gardens, they're an old apartment complex, and they have a huge courtyard in the center. All of their resident rooms are sliding glass doors, and everyone looks out into the courtyard. The nurse carts run on the sidewalks. Those nurses have been there forever. They love it, and they can handle the summer heat, but obviously we have a little bit harder time placing there in the summer. But for those residents that really need the home feel, the outside feel, tons of room to wander, trees, nature, just a huge, huge courtyard, just kind of picture an open unit hotel, and that's what Maryland Garden looks like. And they do really well there, and having the step down unit with the AL side and then a little bit of the skilled also is what we've got going over there. Encanto Palms is just assisted living. They have been around forever. They tend to run about 100% occupancy most times. They have 3 different units over there. They're SMI behavior units, all of them, and then they're challenging dementia with behaviors. It's nice because we can kind of step our patients down, and our goal is always to step them down from the higher acuity at Ridgecrest and Palm Valley and then get them into the assisted livings and then possibly back in the community. That seems to work well, but our assisted livings do a great job, and it's kind of a nice resource for us to have as a skilled facility. Being behavioral is having the behavioral ALs. And then, like I mentioned, Cottonwood is the same behavioral AL that's out in Cottonwood, or excuse me, Austin House out in Cottonwood, serving that population out there. And that's a little bit about Windsor Healthcare.
Terrific. Does anybody have any questions for Sarah? If you do, just unmute yourself and you can ask, or you can type it off to the right on the chat.
Sarah, do you have an email address people can have?
Sure. It is S.Kaufman, Kaufman, at windsorcares.com. WINDSOR cares plural.com. And if you're, yeah, I can forward any referrals or any packets any of you may have over to Sheila for the behavioral health piece, if that's what you're looking for, if you need help with that. Even if they're just respite or temporary, we can also do that on the behavioral side.
Wonderful.
Thank you.
And that's Windsor Cares, all one word?
Yes.
Okay, cool.
Thank you. Yep, that's correct. Thank you, George.
Yep.
Terrific. Well, next we have Zach Shaw with us. He's with ASNAHA, the Arizona In-Home Care Association. Zach, you there?
I am. Thank you, Kyle. And thank you, Bill and Sarah. Appreciate you guys having me today. I see a lot of good faces on here, people that I recognize. I usually start these presentations by asking who hasn't heard of ASNAHA, but due to the format today, I'll briefly cover who we are. And if there's any questions or concerns, please do reach out to me. ASNAHA was founded, I believe, back in 2007. We are a trade association for best practices in home care. Arizona is a non-licensed state. What that means is there's no government oversight for anyone doing personal one-on-one attendant care in private homes. ASNAHA, a couple companies back then decided that, hey, we need to set some standards for this industry, legitimize it so that we mitigate elder abuse and are generally just protecting our senior communities with people going into their own homes, especially with conditions like dementia, where they can't protect themselves, and ASNAHA was formed. If you want to see any of our practices, best practices and credentialing that we require in order for someone to be an ASNAHA member, I would ask that you visit our website. That's asnaha.org, A-Z-N as in Nancy, H-A.org, asnaha.org. You guys are lucky today because you actually have two board members here that I can see. Angie from Nurse Next Door, she just waved if you guys have the Brady Bunch thing going on here. She's also a board member, a new board member this year, and we look forward to having her present at some spotlights in the future. But like she had mentioned when we first started, this is her first one. So Angie, thanks for being here. And anyone who wants to reach out, she's also an expert in this industry. So with that, today I want to talk about a little bit of where ASNAHA is with the current environment and what we are doing. As always, and I will always advocate that anyone using in-home care companies should always be referring an ASNAHA company. There are a lot of reasons. I've already mentioned the best practices and the standards that we set. But it's also the sense of community and the amount that we all talk and trust each other and work for providing great care for our senior community. The COVID-19 thing, obviously, we're hearing about it every single day, probably every single hour, every single minute. And ASNAHA has tried and is still an active leader in being a resource hub for our home care industry and what our caregiving companies can do and how we can protect both caregivers and clients. Our website has a members only page, and as a member you get access to a lot of these resources. Just briefly to go over some of those things that we are looking at, we have a couple attorneys, pretty big shot attorneys across the nation who have been actively feeding us information. That stuff is on there on the website from Bob King and Littler. It helps us understand where we fall in the healthcare continuum, what it means for our caregivers to be in self-isolation or if they get sick. Steps that we can take to protect both caregivers and clients, and just best practices in general when we're talking about communicable diseases and especially around this current pandemic. Again, I'm going to reiterate a lot, but another reason why you want to use an ASNAHA company is because we have access to all these things that we are doing the best that we possibly can to protect the senior community, especially those of you in communities themselves, assisted livings, ILs, etc. Another thing that we have on here, we just put out a webinar from a company called Home Care Pulse, who is partnered with In the Know caregiver training. That training is on our website. The training allows us better practices to help, again, serve our caregivers. It also has some take-home material to train your caregivers on proper use of PPE and what to look for, how to know to check for, if a symptom is occurring, what to do. Again, these are all ASNA companies who have access to this information so that their caregivers are well prepared. This helps mitigate risk. It helps mitigate hospitalizations. It won't stop it completely. Obviously, if someone gets a virus, but at least our caregivers should be, and the companies that are ASNA members have access to this enhanced training that is a national platform. So that's great. ASNA companies have access to childcare resources for caregivers who have children whose schools shut down and they don't have anywhere for their kids. We do have childcare resources posted on there as well to help out and keep these caregivers working if at all possible. And last but not least, we've been, especially Aaron Sinekin from Devoted Gardens, he's not on, I don't believe, but him and I and a couple other board members have really been trying to find PPE equipment for our agencies and our caregiver workforce. It's very difficult, as you all probably know. And a little history too, home care wasn't necessarily considered in the relief bills, and we had actually had some problems getting PPE because we were not considered an essential healthcare entity. Home Care Association of America, along with ASNA, fought really hard to get us included into that bill, and thankfully the government saw the light and has included us, and we are an essential healthcare entity at this point, which is great. What that does for the future for home care, I'm not sure, but it keeps us in that conversation. Now includes us under that umbrella, which can only benefit a patient at the end of the day. So what does that do for us right now? It allows us access to PPE, meaning distributors, sellers, everything else can get it to us. And if we are in a community, if any home care company is in a community that you're an administrator of, a director of, please make sure that that you have proper PPE for them as well. Again, home care companies have been strapped. We're doing what we can. Some of us have been very fortunate and have a ton of PPE, some of us not so much. But if a caregiver has been trained and has all the necessary skill sets, as long as they have the necessary equipment, they should be able to do the job. And obviously we want to protect everybody. So again, if we can all be partners in this, that would be a huge help. Let's see. Outside of the members login, the member benefits only from ASNA and what ASNA, what resources are there for our members. We are also putting out a YouTube video every month. That YouTube video is directed at members, but also has a lot of good content for our general healthcare community to keep up to date on what we're all doing, trying to lead this industry and be a good partner of yours. It's called a fireside chat, or some people call it ASNA now. We're trying to put one out every month, but it's basically an update on everything that's going on. Unfortunately, you have to watch my face, but at least the content hopefully is pretty good. But you could check that out on YouTube, and it's public domain. So you just go on YouTube, type in ASNA, and you should see the videos pop up. There are 2 on there currently, and I believe the last one was in early March, and we did address a little bit of the COVID situation in that as well, and steps and things that we're trying to take. So stay tuned, because we have another board meeting later this week, and after that board meeting there should be another video put out, so we'll have even further up-to-date information on there. I think that's about it for right now. Open it up to Kyle or questions or anything else.
Thanks, Zach. Anybody have any questions for Zach?
Zach, what's your email address?
My personal is zshaw, ZSHAW, @affordablehomecare.com. If you do have any general comments, questions, concerns, even complaints, and you can submit complaints as well to ASNAHA. We do look into everything. Again, we want to hold those best practices and standards. We can't tell someone how to run their business, but we want to make sure they're at least doing it ethically and by our standards in order to stay a member of the association. And that email is info@asnaha.org. So info@asnaha.org.
Great. Any other questions? Okay. Is Boss Spiros, is he with us today? I don't think I saw him. Okay, what we'd like to do now is just open it up. If anybody has an announcement or something they want to share with the group, we'll take one at a time. Maybe if you could type in the question or unmute yourself, that would be great.
Hey, this is Paul from Quail Run. Good morning, everybody. Just wanted to let everyone know we do have beds available in our Gero floor. We have implemented an isolation room, and we will add more as needed. Right now, we've been screening everybody coming into the building. We've stopped visitation because of COVID-19, but we're all pretty much been working the liaisons from home, going out into the community as needed, looking for PPE stuff to bring in, for our staff as well. But again, appreciate the opportunity of being on the call, and everyone stay safe.
You too.
Hey, this is Elizabeth with Neighbors Who Care. Can you guys hear me? Yes?
Yep.
Okay, good. I just wanted to let you know, a lot of folks are asking. We are business as usual. We're still serving the seniors who are homebound in Sun Lakes and South Chandler. And we've had a lot of volunteer interest, of course, which has been a blessing for us in a way. But we are accepting donations of toilet paper and sanitizer. We get quite a few donations every day, and we get those to the right people. So just wanted to let you know we are still serving seniors, and it's kind of busy, and they're a little bit, they're still a little worried, but things are okay.
Hi, Kyle, this is Laura from Bella Vita. Can you hear me?
Yes, we can hear you.
Yes, thank you for having us. I wanted to touch on something that was mentioned earlier. We have an assisted living home. We are managed by a nurse, and we are accepting residents very, very cautiously, where some homes are a little bit concerned. And I don't want to take this lightly, but we are doing phone assessments. We are, when we do take a resident in, quarantining them, similar to what Paul had said, for a few days to make sure that both they are safe and our other residents are safe. And we are putting in extra special caution with masks and gloves to ensure the safety of all our residents. So I want to bring that out there in case anyone is looking for a home. We would definitely consider taking in a senior with the right credentials. Thank you.
Then after you ask your question, mute yourself again. Anybody else have a question or something they want to share?
I would like to mention something. Can everybody hear me okay?
Yes, we can hear you fine.
Stacy, the local Medicare broker, so I help seniors with their Medicare benefits and just, saving prescription costs and things like that. One of the things that I'm looking at doing is buying a bulk of these handmade masks that people are making and just handing them out to my seniors, the people who might not have any, can't get their hands on them, not able to make them themselves. So I'm wondering if anybody has a connection of these handmade masks that maybe I can buy a bulk from for my seniors.
So it looks like Blake just put something on there.
Perfect.
Blake, are you there?
Well, it looks like Robin's making some too. So yeah, if anybody has, sorry, go ahead. Go ahead.
I just had to unmute myself. My family, we're making some. We're just looking for people that accept the cloth mask. Some places don't accept them, but yeah, I was just asking if anybody accepted them.
Okay. So maybe can you put your information out there and I'll reach out to you? That'd be great. Thank you.
Hello?
So it looks like, Blake was asking if anybody, any assisted living homes or communities are accepting the homemade cloth masks, that he's making some to donate to caregivers. So if anyone is looking for some, be sure to jot your email down in there. Looks like, I think Blake's going to probably put his down there as well, so you can reach out to him as well. And then Robin O'Connell, she said she's making some, and her email's in the chat box as well. So be sure to jump on there and chat with her as well. Blake's got his up there as well. So.
George, can you mute everybody and then unmute again?
Yeah, let's see.
Sounds like a background noise.
Unmute, there we go. Oh, sorry. Go ahead.
Awesome. Any other announcements or questions or information anybody wants to share?
Can anyone hear me?
Yep.
Oh, can you hear me? I lost my video feed.
Yes, we can hear you. Who is this?
This is Mike Rasmussen with Smooth Transitions and Fast Finds Estate Sales. I know many of you. I just wanted to let you know we're still doing Smooth Transitions. It's still doing some limited packing and moving, of course, with the utmost precautions. So some people have to move, and we are still doing packing and moving. Estate sales are obviously shut down for right now, but we are doing a lot of online sales for clients that are moving and need sales. So we are still in business, Smooth Transition, limited, and we are doing most of our sales online. We're still doing limited packing and moving. We work with some of the big senior communities around here, and of course, we're working with them of necessity to help people who really need to move and get packed up. So we are still doing that, selling online, and I just wanted to announce that Smooth Transitions. If you need anyone in a dire position, we have certain people who have been quarantined, and we're just plugging along. So we're still here.
Cool.
That's it. And hey, everyone be safe. I'll put myself on mute now because my video feed's down. But that's it. Thank you so much for the opportunity to talk, and thank you so much for the information. And I will mute myself and continue listening.
Thank you.
I missed the name of the person from Smooth Transitions. Can you put your contact information in the chat, please?
I can't right now. I don't know what's going on, but I lost my computer feed. All I have is phone, but it's Smooth Transitions, smoothtransitionsvalley.com. I apologize. I can't get into the chat right now. I'm working on it.
Can you see it? Can you email me?
I can't see it. I'm restarting everything. And I've done a million video conferences, and of course, it's just cricket crash shining right now. But I'll work on that. But yeah, we got the valley.
Okay.
Yeah, I'll work on the chat.
Hi everyone, it's Nancy Winters with Legal Shield. I just want to let you know, I know there's a lot of members here on our phone with Legal Shield, on our Zoom call. All our law firms are remaining open, and they are working around the clock to help, as you may have some kind of legal support you need during this time related to this coronavirus. They are full service. Anyone that would like some information, you can contact me. I put some information in the chat, my direct phone number, and anyone that needs some help that you can think of, get in touch with me. And we also are having a $25 Visa gift card when people sign up. Help them get started the first month. Thanks.
Hi, can I jump in now?
Yep.
Okay, my name is Ida Jones. I'm with the Musical Instrument Museum, or MIMS. So this is a little bit different. Before all of this started, we were putting together some creative aging programs. We already do some in cooperation with Banner Alzheimer's for individuals living at home with their families, where they can come into the museum and then there's a music therapy session. The second part of the program, which is the one that we were preparing to launch, was creative aging for groups. So working with senior home facilities where a small group would come into the museum, tour a gallery or two, kind of keeping it limited, and then having a music therapy session to be in concert with the gallery that we visited. So obviously everything is a little bit on hold. So one of the things we're trying to look at is what we can do in the meantime to give people kind of a stress relief, which music is. So we certainly have noted, as everybody has during this entire process, that music is such an important part of what people are feeling, especially those who are isolated or people with early dementia or dementia in general. So just as an FYI, until we can get back to programming, on our website, mim.org, on the bottom there is Facebook, and you could join in. And we have different music related videos that you could go on and see, and programming. Some that may, if people have access to their computers, that they could see it. So whether they're in a senior facility or at home. So that's just, I just wanted to share that with you. And then down the road, hopefully we could open up we'll be able to have the programs back in the museum. So that's mim.org. And then on the very bottom, if people go, they can go to Facebook or one of the other social media outlets. That's it. Thank you.
Hey everyone, Joseph here with Amada Senior Care. Just wanted to let everybody know that we are doing remote learning webinars every Wednesday and Thursday, ongoing, with what's going on. We're doing webinars. Our top webinar that a lot of people love are Unlock $300,000 for patient care by asking one question. We're doing it on elder abuse, and other ones on understanding senior care options. And another one that we're doing is the 4 funding options for senior care, how to unlock all these to help our seniors find resources to pay for in-home care, assisted living, residential group homes, or memory care. So if you want information on that, we have it posted on our Facebook page at Amada Senior Care Mesa. Or you can just email me directly and be more than happy to share that information with you. It is ongoing. So yeah, that's all I have to share with you guys.
Good morning, everybody. Can you hear me okay?
Yes, we can hear you.
Well, this is our first meeting. Both Robin O'Connell and myself were from Nurse Next Door, providing care in East Valley. And so I just wanted to introduce ourselves and thank you for putting this on so that we can still stay connected. We're definitely looking forward to getting involved in the community. And so I do have my email address, as Robin does, here in the chat. If you all are interested in connecting, we can always do another Zoom video on one-on-one. Please send me your email and we'd be happy to do that. Thank you. It's good meeting you all.
It's great to have you guys. Thank you.
Thanks.
Joseph, can you provide us with your direct email?
Yes, I'll do that right now.
Okay, anybody else want to share?
Hello, how are you? This is Charlene, Sergeant with Helping Hands.
Hi, Charlene.
Hi, hey, I just wanted to say I'm still doing many placements right now, and it's been challenging. For the last month, I have been having anybody coming from a facility, whether it be rehab or hospital, provide 72 hours of vital signs, and then the morning to the home or our facility they're going to, and then the morning of discharge, vital signs again so they can see temperature and all that. And I have been recommending to any place that somebody is going for the last month that they keep the person isolated for 7 days. But last Wednesday, DHS came out with a recommendation, or I have it right here. It's any COVID positive or COVID unknown resident it being admitted or readmitted to a facility should be isolated in their room for 14 days. So that's what all of the places are doing that I'm working with, just to be safe, to make sure that they're not exposing, any awful virus to their other residents. And so that's kind of what I've been doing. And like I said, I started that about a month ago with just the vital signs, and what I've been doing with the case managers is just having them text me or email me vitals the morning of the person being discharged. So then that way, whenever I'm setting up, I can set up transport and all that at that point. So that's what I've just been trying to do to make sure that everybody's safe. I mean, this is really a tough time. And like Bill said, there are some places that are not accepting residents, and there are some places that are not accepting residents that are on hospice because they don't want extra people coming in. But several of the hospice companies are doing video, like Facebook meetings and things like that, instead of actually coming into the home, to protect everybody. So it really is just up to the home and the facilities and what they want. But yeah, it's really tough times out there right now. It's scary with doing all these placements and trying to help these people. So
that's a really good point, Charlene. Again, this is Bill Cave. While we have everybody on here, if we have any communities or group homes, I'm going to put a email address for passers on the chat. Can you let us know if you are accepting COVID-19 clients, residents? We're trying to build, and I did get this request from passers. So if you could email and just let us know if you have any availability from either the home or the community side. Thank you.
This is Sarah Kaufman from Windsor Healthcare. We, on our call that we had with Governor Ducey for this from the SNF side, and I just want to speak on that, we were reminded that we should not be denying patients just because they are COVID positive. That is a regulation that went into effect in California also for our skilled nursing, and then in Arizona, making sure that we can accept them and we are prepared. We are doing our best. We currently do not have any in the Arizona facilities because with the behavior criteria, there needs to be everything and the other side with it. But my question, and Charlene, thank you for your comment, it kind of brought it up to me, is so we're doing the 14-day isolation. We have the secured units, but staffing, and I don't know if anyone else is struggling with that. We are in a position where we're treating every patient as they are COVID positive or could be, and we're worried about our staffing and our CNA and our nursing needs. There is, hero pay and those type of things going on with the company. But I want to make sure that should we get somebody that is positive, that we are prepared to treat them, because that's kind of been an issue, I'm sure, as we've all seen on the news. Once a facility of any type gets a patient, there tends to be some staff running and just abandoning our patients. So we're trying to reach out with anyone that knows of any resources for staffing agency or anything else to help us with CNAs and nurses. Should something happen, we want to be prepared and make sure we have the correct staff. And so I just kind of wanted to see if anyone could put maybe in the group chat or email me separately if you know of any nurses or CNAs, as we all do, that are, you know, willing to work or willing to volunteer or, you know, ready to step up with us. We just want to make sure that we're prepared. Should our facility have an outbreak or have a, you know, even not an outbreak, I would say, you know, 1 to 3 patients. I think we're pretty prepared on our COVID unit, and have our isolation unit would then turn into a COVID unit. But we want to make sure we're just prepared to handle the needs and have enough staff to take care of anyone.
Very
Robin
good.
O'Connell here with Nurse Next Door. Sorry, didn't mean to interrupt you, Kyle.
Yeah, go ahead, Ed.
I'm sure Angie and I are both on the same page with this. We want to let everybody know that Nurse Next Door is still available for home care. We are equipped. We are doing self-assessments on all of our caregivers and client assessments, and that is at the beginning of every assignment. So we are monitoring very closely for any of our caregivers or clients that are showing any signs or symptoms of COVID-19. Fortunately, we have not had any issues with that. But we are available in my email, and Angie's email is in the chat feed. So if anybody is interested in reaching out to us for caring consults, we're certainly willing to do that.
Great, thank you. Anybody else want to share? Okay. I just want to remind everybody that our Spotlight Resource Guide is digital on our website. You can find Spotlight Senior Services there. It's a great way to get resources out to people who you can't hand them a Spotlight right now. We're going to continue doing these events every month. I think this works out well doing it valley-wide. There's no distance restriction, so we can all get together and talk about what's going on throughout the valley. Does anybody have anything else they want to share before we conclude the meeting?
I do, Kyle.
Yeah.
How you doing?
Good, Laurel. Good to hear you. Good to see you.
We are celebrating 34 years this month. It's so sad we can't celebrate in person. Anyway, when are you doing the new Spotlight magazine? When does that come out?
Yeah, so we put it back a month. We'll be coming out in May. The end of May, they will be printing. So there's still time if you want to advertise with us. We're doing a special deal right now as well. Thank you for reminding me. If you want to join and funds are an issue right now, we'll do a one-time printing. Usually we do 2 printings for the year. We'll just charge you for 1, make it a discounted rate that way for those that are wanting to reach out and advertise. But thank you for asking, Laura. What else did you want to know?
And you know, I didn't even, a lot of people on this call I don't recognize, so they may not know who I am. I'm the community liaison with Family Home Care. We provide in-home non-medical services, and again, celebrating 34 years. Thank you.
Thank you, Laurel.
Hey, Kyle, I know we have some newer people online. Maybe you want to let everybody know, you know, this is obviously a different structure than normal. Usually you have an East Side meeting, North Scottsdale Phoenix meeting, and a West Valley meeting. Maybe want to catch everybody up, and then also having the Tucson and Northern Arizona meeting.
Yeah, absolutely. So I think for right now, unless I hear differently, I think it's a great way to get everybody together for the Phoenix area. We do have a Tucson coming up on Thursday, and our Northern Arizona one is the 4th Tuesday, the 28th, I believe. So if anybody wants to join those, just send us an email. We'll get you that information on how you can do that. One of the things we're doing now too, I just thought of, if you're an advertiser with us, maybe you have a video you want to post, and maybe you want to have virtual tours, we can post those on our website and help get the word out about that. Since people can't come to your facility, they can see a virtual tour. So reach out to us about that if you want more information on that as well.
Cool. Excellent.
Okay. All right. Does anybody else have anything they want to share? We want to make sure everybody has an opportunity to share. If there's something you're thinking of that you think we can help benefit from, please do so now. Otherwise, we'll just end the meeting.
Cool. Kyle, they asked for your email. I put that on there for, and then this meeting is being recorded. So I've never recorded them before yet. So I'm just trying to see kind of how that looks and sounds. So Kyle will get a copy of that. So just that question was asked. So
yeah.
George.
Yeah.
George, this is Robin with Spotlight.
Yes.
Hey, could you add my email address as well for anybody who's wanting to post one of their videos or virtual tours? I'd be happy to put that on our website if you are an advertiser. Mine is robin@spotlightseniorservices.com.
Excellent. I'm going to put that in there right now.
Thank you.
Yeah, thank you, Robin. And also, if you're an advertiser, we do have a blog, and it's a great place to put out information that you think can be beneficial for families and caregivers. So don't forget about that as well. And again, that would be to Robin.
Cool. Well, excellent, Kyle. This is awesome. I appreciate you doing this and taking a leap of faith with me on this on this Zoom type of platform. It's great to see everybody's smiling faces, which most of us are normally used to being out and about and visible in the communities and pounding pavement together and racking up miles and gas mileage. It's great to see everybody out and about. So this is totally cool and fun, and I appreciate you, Kyle. Thank you.
No, thank you, George, and I couldn't have done it without your help. So thank you for being there for us. So, all right. Well, guys, it's great to see everybody. Please be safe, you and your families, and take care of our seniors. And thank you for all you do. We appreciate you. All
Thanks,
right.
Kyle, for helping me.
Thank you.
Cool.
Thank you.
All right. I dropped off pretty quick. And then there were 6 of us.
Thanks so much. I really appreciate it.
Cool. No, I thought it was pretty good. We had 51 people up there at the most. I can go back probably and look at the I go up there and probably look at the statistics on when people came in and out too. So probably more than 50 people.
Wonderful.
So cool.
All right.
Excellent. Thank you,
we'll
Kyle. I'll find out how to get this recording to you, and we'll go from there.
Okay. I'll see you on Thursday.
See you on Thursday, buddy. Thank you.
Thank you.
Okay. Bye-bye.